So that is the end of the presentation part. I think there's been lots of great and interesting discussion. So, you know, maybe what we can do then is read out some of the questions, or Sume and Jamie, I'll pass it to you for sort of opening the line to have people talk through any questions they have or experiences that they have in their own institutions.
Absolutely. Thank you so much, Fareen, Tina, Kim, for sharing your work. I think what you're showing is that organizations really need to look at themselves in a very comprehensive way. So the case study we just talked about focused on a very, very specific practice, which we hear a lot about. And just even reading the comments, I think we're seeing some pretty consistent feeling that we can't have those things be one-off. So it's really great to see that that consensus around it, that we need to be looking at really broad strategies. So there have been a couple of questions which have come in, and it's really great to see people responding to each other in there. Maybe what we could do is we'll start responding to some of them, and if we're not able to get through all of them, we can follow up by email with a few more links if people share those, or some more resources as needed. So there's been a lot of conversation about data. So for maybe we can start with this idea of, you know, how do we collect data? Should it be mandatory or not? Should organizations make it mandatory but then provided as optional for employees? And how do you actually collect data and then do something with? So it's not just, I think someone called it a dead box on a website or something, right? So you collect data but you do nothing with it. What are your thoughts on that?
Yeah, for sure. And I think, you know, one of the things that I tried to emphasize was the whole idea of whoever's designing this questionnaire or implementing it, they need to discuss why they're collecting that information and make it really clear that what they're doing with it and why it's being collected. I know I saw a comment about, can you ever make it mandatory? And I don't think so. I mean, I think you have to have a space for people to opt out, because it's not safe so it may not be safe for people. They just don't feel comfortable doing that. And I think that, you know, the number of people that may answer as I don't want to disclose is also a bit of an indicator. I mean, in that case, you might want to start with just perception surveys versus, I mean, there's lots of ways to collect staff information or workforce opinions, short of asking the question of what do you identify as, you know, before it's really safe to do that. So I think you have to just figure out for your own organization, where are you in the process of this type of change, and maybe asking a small group of staff too, or having a committee. I mean, most people are not doing these interventions by themselves. Ideally, for all of these things, you're engaging staff, and people, frontline folks, will tell you, or everybody will tell you how they feel about if they were asked that question and what the best way is to go about it.
Great, thank you. I think if we extend that conversation of data beyond just organizations, I think we see that in Canada there's a real dearth of data around race and racism. So I think generally we need to just get better at doing it, and there are really good guidelines out there about how to do this. Census Canada, the census currently does that. I think we could improve that in a lot of health-related work, which we don't do that very consistently. We don't do that well. I mentioned the example of the employment equity legislation. Like, that is supposed to be required, and you have organizations barely reporting back on what they're doing. So I think there are real opportunities to do this. And when you talk to communities, usually most people want that information collected, especially in environments where the lack of data is often used as a reason for organizations not to act. It almost works counterintuitively. So organizations are concerned about collecting it, and then because you don't have the data, you don't really have to act. So I would actually argue that not collecting it can be a very profound manifestation of racism, and obviously you want to be collecting it in meaningful ways in partnership with communities and staff as necessary, so that it's actually used to shift what the organization does. And I think especially when people see that information is being used to actually create better outcomes, then you'll start to see more willingness where that's absent to actually provide that information.
Yeah, it's like that's sort of that whole idea of what gets measured gets action. You know, it's, if you don't know, you're working off a whole unknown basis, and that's not brought to anyone's attention.
And just from building on that, the question about how do we ensure that self-identification is not just a dead button, I think really speaks to the need for implementation, right? So I would argue that you should never have, if you're not going to do anything with that, then don't even bother including it, right? So don't build up this expectation that the organization is actually willing to make change when there is not a plan for how that gets used. I think employment equity statements are a great example of that. So I've had conversations with various organizations saying, okay, I know you have an employment equity statement, one of those which Fareen had on the screen. How does this get used in the hiring and recruitment process and within the organization? For a lot of organizations, it stops at a statement, or there is no sense of, okay, how are we actually going to screen in applicants? What do we do when people self-identify? Like, how do we actually use it in our decision making? So I think really thinking through those questions very deeply before we go collecting that information. Just related to that, there was a question about whether or not there's been research on the impact of various kinds of equity statements and policies. And there's a really great book by Sarah Ahmed. She is a critical race researcher based out of the UK, and she has a book which is called Being Included, where she looks at racism and diversity in institutional life. And what she found, which I think is consistent with other work, is a lot of it can be very performative. So it's almost like the organization, like you develop the policy, and because you have the statement or the policy, then you say we did a great job, and you move on to something else. And interestingly enough, I think one of the things she found was sometimes the documents which got shared more, like very, very often, were those which were rarely ever implemented. So there was this, in the institutional consciousness, there's this sort of myth-making around, we have a policy, we have the statements, you share them, you talk about them, you present on them, but they're not actually being implemented. So I would highly recommend that, because it talks about, it's really experience about how this is being looked at in different sectors.
That's great, yeah, and I think, there's similar questions about, land acknowledgement and also like the email signature, gender pronouns. I think the idea is not to say that there's no value in those things. I think there's a huge value in those things, and they can be really powerful tools as awareness, as people maybe doing a double take or thinking about something they wouldn't have thought of. I think the idea is that they can't be the only thing that an organization does. And without those crucial conversations or making space and listening to, actually being critical of what your own policies are and having that willingness to do that, it only goes so far.
Great, thank you. So we're going to keep taking a few more questions, and I think there's also just some really interesting comments. So Fareen, one of the things you mentioned was the fact that some candidates may be reluctant to actually de-identify themselves, because that's actually a valuable thing. So someone else comments on that, so thanks for that comment. There's a comment around unions. I think unions are an interesting one, so on the sense that union members always have to hire from inside first before you go out. So Fareen, did that come up in some of the work you were doing?
So I mean, when we asked about challenges, I think the process of the, what might be in a collective agreement, like, yeah, sometimes those things can be restrictive, but they're also very protective for a lot of the workforce. So I don't know, I think there's a lot of tension with that one, because there are also bodies that really help people have fairness at work as well, but because they apply to large bodies of people, it won't work for everybody. So I think that is an inherent tension, and not just with this work. So I mean, it came up. There wasn't a solution per se, or literature or anything on that. It just kind of was exploring that tension. I don't have anything too much more insightful about that to say, unfortunately.
Yeah,
but I think it's a good point.
Yeah, thanks for that. And I do think there is a lot of work going on in unions, really trying to address how racism within unions, and we can try and find some of that information and share if people are working in those spaces. But I think one of the very common comments around this is, right, like, racialized folks is usually the last hide and the first fight, and I think in union environments that can really show up, and so it's actually imperative that that work happens. And I do know of examples where it is happening from the union perspective. Okay, great. So I think we can take a few more questions, and yes, we will be sharing the slides after this, and they went out early, but we can resend them with the evaluation information.
And we're having a small conversation in the room here too about, we saw that somebody posted a comment around how, some of the counter narratives are this thing about not being like a good fit. So we just wanted to say that we agree. We do see that come up a lot is in hiring or whatever, or even firing, that if this person just wasn't a good fit for the organization. And so it is important to think through, like, what does that actually mean? Who does that leave out? Is there that racial dimension to it? I think sometimes we see that in this whole idea of, like, we require Canadian experience, or we might screen out a resume because we don't think they've had, like all those things about good fit and Canadian experience, like those could be ways that racism shows up.
Great, thank you. And I think that's actually speaking to the really coded ways in which organizations speak, right? So you hear things about good fit. You hear things about, oh, we just hired the best person for the job. And things like that are really, I think we need to actively challenge those kinds of ideas. And because when you say something like best person for the job, what's behind it? Like, what you're really saying is you don't think the Indigenous or racialized folks can actually do the job, which is a fallacy. Obviously, so I think really getting smart about those really coded ways in which organizations speak and communicate is a really essential part of this. A really good example of this, and I shared the link in the chat box. This book called The Equity Myth, and it's Canadian. It was looking at how universities are addressing racialization and indigeneity in their work, particularly around faculty positions. And it's really good because it's a Canadian example. And what I think about universities as places where, fairly progressive spaces, and even in that setting, they're finding that with similar qualifications, so PhDs to be in faculty, it was still taking racialized or Indigenous faculty 3 years longer to get tenure-track positions, and they were also less likely to get tenure-track positions when they applied. And if you consider that racialized and Indigenous folks actually have more PhDs than sort of their fair share of the population, that shouldn't be the case. So I think we really need to absolutely challenge some of those myths and present alternatives. Okay, great. So do we have some more questions there? And Fareen, if there's anything you saw in the comments which you wanted to respond to, please do so.
For sure. I'm just taking a quick look here.
Okay, great. I just also wanted to reiterate this point, and I've seen this come through the comments, which is really just the need for organizations. Like, if we're thinking about creating racially equitable organizations, we have to look at every aspect of how the organization functions. So everything from the practices, policies, to really the everyday workings of the institution. And I think that's how we'll start to see change, and we can't do one thing and not everything else. So really taking that comprehensive view. And also starting to get a sense of how it shows up within your own institution. And I think we're all looking at the chat box right now. We'll try and fix that so we get the slide back on. So what happened there? Okay, so while we're doing that, we'll take a look at a few more questions that are coming in. Okay.
And just looking at Michael's comment too about the data collection part and being consistent with the anti-racism direction on that as well. I know there's been some discussions here about collection of race-based data on people you serve, but also the workforce. So engaging with whoever sets the stage for what public health agencies do can be really influential in that. So for us, it's that foundational health equity standard. The Ministry of Health really sets the direction. I think that's a great point. And I think I saw some, I don't know if anyone on the line has examples of that being done well. I think there's people from all across Canada, and I think earlier on I saw some comments of people that do this. I wonder if they want to share anything.
Yeah, thanks. That would be great. I see someone's typing there, so maybe we'll get a few good examples of what's going on. And so I know in our own work, we're starting to see a few things pop up. So not around employment specifically, but in Ontario, as an example, public health Sudbury districts now has what they call an action framework around how they address racism broadly. So I think that definitely has a community component to it, but I imagine that it would have some implications for them internally. So I think that there are some promising examples showing up.
Mm-hmm.
Great. So I'd like to thank you again, Fareen, and your team for really being on the call with us today and sharing your perspective. And to everyone on the line, thank you for sharing all the questions, comments, resources, and I've seen some really great engagement online, which is really good. There have been some resources shared, so we will, when we send out a note later, we will include some of those, and we may even include some of the comments. So I think the comments there have been really useful. So if you have examples you'd like to share, please just send us a note, and we'll be happy to do that. I wanted to just end by saying that the idea of creating equitable institutions is not new. It's been a conversation which has been going on for a very, very long time, both in public health and in other disciplines. And this is a quote from the book I just mentioned, The Equity Myth, and they say, the goal of achieving social justice by creating equitable institutions has been constantly promised but persistently denied for racialized and Indigenous peoples. And I think that's a really important thing to keep in mind is like, how do we get smarter about our strategy? So when we implement policies or changes and we don't see the desired outcome, and there was a question about what does success look like. To me, success is when we look at the experiences, both around numeric representation, or more of the qualitative experiences racialized and Indigenous folks are having within organizations, that we stop hearing about the stories of everyday racism. We start to see that your earning outcomes are actually the same. That to me is success. So to me, success is not we created a policy. I think it's a good move. I think we should acknowledge that. But that's not the work. The work is at the end of the day, we need to see really a material and symbolic difference in people's lives. And so I think really going back to the drawing board and saying how can we make our policies, both organizationally and at a broader level, really do what they said you're supposed to be doing so that we see those equitable outcomes in our work. Fareen, any last thoughts for you?
No, I mean, I think you closed off really nicely. That was a really good point. I feel like in this sector specifically, in public health and in health, we really espouse these values of health equity. We talk about it all the time. We care about it a lot, and so I think we can be very strong role models in looking at our own institutions.
Great. Thank you so much, and thanks to everyone who joined us today. We'll be sending out a note with an evaluation, so please do provide us your feedback. If you sent in a question when you registered, which we did not respond to today, we will try and do some work and get some responses out in the next couple of weeks so that we can continue this dialogue, and we'll also include some resources which we find useful. If you have some which you find useful, which you'd love us to share, we're happy to do that also. So thank you, everyone, and enjoy your day.